Thank you so much for inviting me to speak with you today. I'm really honored to be able to share with you all some of our experiences in Texas in fighting abortion bans, especially Senate Bill 8. My name is Kamyon Connor, and I use she, her pronouns. I'm the executive director of the Texas Equal Access Fund, also known as the T Fund. We are an abortion fund that provides assistance to people in East, North, and West Texas who need help affording an abortion. We have a helpline and a text line, as well as providing emotional support to people who have had abortions. We let people know that we make reproductive rights a reality for Texans. We have learned time and time again with abortion care, the legal right to an abortion does not mean you can access the care that you need. This issue of access, especially in Texas, is all too real at the moment. And we are seeing the hardships placed on Texans seeking abortion care spread throughout the country, while also navigating what could be the fall of Roe v. Wade in June. I have been asked a lot, what does it mean and how will this look for people navigating abortion access? Well, I just want to let you know that here in Texas, we don't have to imagine what abortion access will look like if the Supreme Court were to overturn Roe v. Wade. We are already living this reality in Texas and have been doing so for 6 months. SB 8 went into effect on September 1st, but the reality is abortion access has been under attack in Texas and in our nation for a long time. Throughout the last decade, the Texas legislature has passed many racist, classist, and dangerous restrictions of bodily autonomy, including anti-trans bills, pregnancy insurance coverage restrictions, and abortion restrictions that have made it very difficult to access care. We have seen our callers have to travel over 300 miles for care prior to SB 8 and its harmful effects on Texans. And now we are seeing clients travel up to almost 2,000 miles for abortion care. We heard from clients who were forced to delay care due to visiting a crisis pregnancy center and being given false medical information only to have to start the process of navigating seeking an abortion outside of our state all over again. We speak with people who cannot take time off work without fear of losing their jobs to seek medical care. 62% of our callers here at the T Fund are already parents who are struggling to find childcare for their children in order to seek abortion care. And for communities of color, these restrictions have always hit them hardest. Black, Indigenous, and people of color do not have equal access to healthcare, especially in Texas, from abortion care to prenatal care to preventative care. And this is because of white supremacy, racism, and structural inequalities that exist in our healthcare systems and our social service systems. Existing state laws also force providers here to share false information about abortion with their clients, create harsh constraints on public funding of abortion, and implement unnecessary regulations on abortion providers that have forced many clinics to shut down in recent years. Compounded by SB 8, this is causing many clinics and providers to have to ensure that they can provide abortion care very quickly or create partnerships and referral protocols to help Texans seeking care outside of the state. Many clinics in our state are very worried that they may have to close, which would be very devastating for Texans because if we are to find some relief in the future, many of these clinics would be unable to reopen. Prior to SB 8, Texans had so many barriers to abortion care, including 24-hour waiting periods, mandatory sonograms, immigration checkpoints near our border communities, parental consent laws, incurring the cost of lodging, food, and childcare for abortion, no guaranteed paid sick leave to access any health care, insurance coverage bans of both private and public insurance, and a long history of stigma and shame around abortion. I could go on because there are a lot more restrictions people in Texas face. We have seen other states follow in the footsteps of Texans when it comes to abortion restrictions. SB 8 is no exception. This has an impact far beyond Texas. Already, anti-abortion politicians in many states are pledging to introduce copycat legislation to further restrict abortion in their own states. I hear that might be happening in the state that you all are located. Please do know this didn't happen in Texas for no reason, and it could happen anywhere. Texas is the epicenter when it comes to state abortion restrictions, and ultimately also to oppressive laws and legislation that robs Texans of their bodily autonomy. These restrictions show you that though abortion has been legal in our state for years, and is technically legal right now, access has been unattainable for many Texans, and SB 8 is the most egregious abortion ban we've seen yet. This outright ban on abortion affects communities that we serve and communities that we belong to, like Black and Indigenous folks and other communities of color. It's intentional that these communities do not have equal access to healthcare. It also, we also have barriers to healthcare in Texas when it comes not only to abortion and prenatal care and preventative care, but also mental health care due to racism, sexism, and structural inequalities. Anti-abortion laws like SB 8 are designed to hurt people with limited incomes, queer and trans individuals and non-binary folks, and people living in rural areas and young people as well. I'll share a little bit more about what we're seeing in Texas now that SB 8 has been in effect. We have a text line, and we hear from people texting us, not understanding what's going on or what they should do. We've been getting lots of texts for resources and accessing abortion care, trying to figure out the nearest clinic to go to, and how they're supposed to travel out of state. People just want to know what they're supposed to do. This law is very confusing, and that is by design. We continue to receive calls from people seeking abortion care, asking us assistance paying for their abortions, and we are supporting over 90% of the people that call us with getting abortions outside of the state of Texas. Clinics in our region and surrounding states are struggling with scheduling appointments. Appointments in neighboring states to Texas have appointments out 2 to 4 weeks. So people are waiting much longer to receive their abortion care. Clients are also calling us, trying to travel to places like Maryland or Baltimore because airfare rates are cheaper there. People are going to Oregon and California because they have family there. So we're also seeing that people aren't just going to our neighboring states, to go to places where they have support systems and where it's economical for them. On top of helping folks in dire situations every day, we are also working to provide protection for ourselves and our volunteers from frivolous lawsuits that this law opens us up to. This is something no workplace, no staff person, and no volunteer should ever have to suffer through, because it is your First Amendment right to choose how you spend your time. Personally, I want to share that folks in Texas abortion funds are super fearless, fierce, and very dedicated. We take bold action, and we want to see bold action from you. We are also abortion forward. We talk about abortion in a really compassionate way that's also inclusive, because we know that is what Texans deserve. Access to abortion is not just about legality. It's about our dignity, our humanity, and our freedom. We will do what it takes to make sure people can get the abortion care they need, raise their families in safe, thriving communities. And it's going to take not just us, but all of us working together. I would urge you to also learn from us in the ways that we talk about abortion and in the ways abortion funds are helping to reduce the stigma around abortion. We're building a future where people can get an abortion where they need it, and our decisions are met with love and respect. We are in this for the long term, and we won't be backing down. We need you to do the same. To close, I wanted to share that in the summer, we held a rally against SB8 at the Capitol, and I was asked to end the rally and leave the audience with a message. Now, I'm a chanter, so I believe in the power of collective voices. And I led the crowd through a chant that was, I believe that we will win. I believe that we will win. And I still believe that we will win, okay? Even 6 months into SB8, I still believe that we will win. And though we may not know yet what our path to victory is, and we may not have a map for exactly how we're gonna get there, I believe in us. We must be steadfast and unwavering during these uncertain times. So my final thoughts to you as advocates and change makers is to remember to care for yourself throughout this journey. Do what you can to remind yourself of why this kind of work is important to you, why you got involved in this type of work, and honor that every time you get a chance. I do so with my altars at home. You can probably see one behind me. So I just wanted to remind all of you that there's always some light that will come. And I want to share my light with y'all today. This is to honor all of our work, all of our future work, and the work of our ancestors. Thank you so much for having me.
Yeah, thank you so much for those powerful words, Kamyon. I'm just so happy that we are able to have you here with us today. Again, my name is Shayla. I am on the Under Restrict Leadership team, and I'm also the executive director of Our Justice. And I have the great pleasure of chatting with Kamyon, my colleague, my sister in this revolutionary fight with me. And I'm just so excited to be here with everybody today and showing deep gratitude. I love that part where you put the light together, because that was everything. That was everything. We need more of that energy.
Yeah.
I feel like a lot of the emotions, a lot of the energy is like, what's going to happen after the fall of Roe? What's going to happen after the fall of Roe? And you're here to show us, like, you all have been living in post-Roe already. Actually, one of my questions to you is, like, how is post-Roe going to change, the work that you do? And you've answered it eloquently already in your speech, is that you have been living it. Are there any, like, tips that you can give to people like myself or other in other states that have copycat bills that are going to show up? Like, even if whether Roe comes or goes, there's copycat bills popping up left and right. Mm-hmm. What kind of things do you think that we should be preparing for?
Though I don't feel like the courts necessarily are the thing that are going to save us, I think you got to shore up your legal supports. So I think it can be hard to do that when you're in the middle of a crisis and emergency. It's a lot easier to do that as a plan. I would suggest speaking with attorneys that could offer you pro bono support, or funders that will fund the attorneys to provide you with support. so that it's not an expense to you or your organization. But I would also suggest like a state and federal strategy, if at all possible, in ways for preparing for if this actually happens. As an abortion fund, like we're direct service, so have always been helping people access care in our state. And we've always had the muscle memory of helping people get outside of Texas for abortion care because of the harsh restrictions. We have a 20-week ban here. So there are lots of clinics that we already worked with outside of Texas. I can say that like we're doing a plan, right? Like we got a little test run of what we needed to figure out how to do when SB8 happened. It included a lot of communication one-on-one with clinics. Some clinics didn't really have it on their radar. And it was like we were alerting them that they might need to prepare that Texans are coming. Like
yeah,
literally,
that's real.
We should think about this, right? So like, I think those are things that that we did. We realized, oh, we have to create relationships with so many funds in so many states and clinics all over. There was no way we could have prepared to engage with clinics in Maryland or Baltimore. But we could prepare for the ones that are around us. So we also had to adapt some of our procedures for like being in relationships with clinics, how we pay clinics, how we have contracts with them or whatnot. Like we have to really make those things more expedited and streamlined to not cause any delay for the folks that are actually seeking abortion care, so we can like help them as effectively as possible. But I would say you would want to look at like the states around you, right? Like Ifro Falls, have you looked at this map of the 26 states? Like what states around you will be left? Is it yours? Is it a different one? Like where will people needing abortions need to go? Where are the place, will they be coming to you? You know, like those are some of the things you might need to think about. Because clinics are already like at capacity for the most part. Like they're booking abortions day in and day out. So having people come in from other states creates a huge strain on them and their staff. The folks in Oklahoma are staying late. They're committed to serving X number of people a day, even if it means they stay late. So those are some of the conversations that folks might want to have with clinics that are in their areas as well. Like, are you a safe place for folks to go, and how can we work with you to create more capacity for your clinic to see more people?
Yeah, I think that's at the heart of Unrestricted Minnesota too, is that we saw this coming a little like way back in the day. Like it's not like, I know a lot of people are saying these are unprecedented times, we didn't see this coming, but we knew this. Like we saw happening in other states. We saw that was happening in Texas. We saw that were happening across the country. And we knew that, and even in our own state where we have a lot of protections, that abortion rights are always under attack. And so what we needed to do is beef up security, basically. Yeah. And make sure that we are going to be a place where people can come, because, in the upper Midwest, we are surrounded by North Dakota, South Dakota, Iowa, Wisconsin, and it's just us and Illinois who are going to be taking in people if Roe were to fall. And so that was a whole motivation for the work that we're doing right now. And we really look to states like Texas and organizations like the T Fund to be a guiding light and to help us curate what we need to do here, because we know that's the future and that's what's coming. Yeah. And you even talking about, sending people so far out, in my mind, I'm like, oh, we're just going to have the people around us, but I'm not thinking about coming from across, because we even had somebody from Texas who was here maybe 2 or 3 weeks ago. Somebody from Texas said it's not always about the nearest place, it's about where your connection was. That person had a person here and they decided to travel from Texas to Minnesota for their care, even though they had to wait a couple weeks because we're already booked out too. But yeah, that's so wild. Even though I'm in it, I didn't think of that. Yeah. So you were talking about beefing up like your like the lawyers. And I'm thinking about how abortion funds were mainly started off of volunteers and then, you know, from volunteers to staff. And now we have people who are just dedicated to making sure that people had access to, you know, reproductive health. And they're having to, you know, contact lawyers and contact, and you guys have to change the way that you operate. Like, what are some of the changes that you have seen that were like, oh my gosh, I can't believe we have to do this? Like, for example, in the bottom of your email, when we're emailing, it says, Texas Equal Access Fund is endeavoring to comply with all applicable laws and regulations to the best of its understanding and ability, including the changes to Texas law made effective September 1st, 2021. Nothing in this communication is intended to encourage, assist, aid, or abet any violation of those changes or any other law. The foregoing communication does not constitute legal advice from Texas Equal Access Fund. Like, that's just wild that you have to include that in like a signature along with like, hey, I'm Kamyon, and there's like that big paragraph.
Right.
In addition to that, what other things have you seen?
Yeah, so I think to kind of speak to our emails, like we did have to go through an analysis of our service delivery, our donor database, the way that we store information, how long we store information, policies about how long we have to store information, and create some of those things before this law was implemented, because it is so vague. Aiding and abetting is literally that they don't define what that is. It's vague enough to be communicating with us. If they, you know, it's vague enough to be communicating with us. It's vague enough, you know, on purpose, like it's vague on purpose. And so we want folks to understand that like this law is vague and we're still going to work, right? This law was made effective to intimidate us from doing the work that we know we should be doing. And we're not going to stop doing that work. So we've had to, create more policies and procedures. We've had to increase our security for our websites, our emails, any database that we use with the support of Digital Defense Fund. We've had to get grants for our staff to have Delete Me, our staff, storytellers, any volunteer that wants it, and board members to have Delete Me, which erases your address from the internet.
Wow.
But it's a service you have to pay for, right? And that's not, that's not a joke. Like the security is real. Like I recently had antis post court documents to a website that had my address and phone on it. So like, these are like legit serious concerns that we have. And we had to take a lot of steps to like ensure the safety of folks. Also, it could mean people that donate to us, right? So like, it also means that there's a risk of many of our donors no longer donating to us because they're afraid that they are going to be construed with aiding and abetting, right? So having to come up with creative ways to fundraise or receive pass-through grants or donations so that we can continue to do our work in a way that's safe for people to donate and also allows us to support Texans.
Well, I think maybe I have time for just maybe one or two more questions, Kamyon, before I let you go. But
okay.
Yeah, this is so wild that we are living in these times and it's here and it's not here. Like you're living in it and we're all holding our breath until June. But it's here already. It's already here. um, what is, if there's anything that Minnesotans could do that would make a difference in the politics of abortion in Texas, or for people seeking care there, what do you think that would be?
I think that, I think a little bit like I mentioned, like reducing the stigma around abortion is a huge thing. I think if we can do that, we can have a president that says the word abortion. Like if we can do that, we can make a lot of strides around abortion being a spectrum of the healthcare realm. I think that donations are super important. I know a lot of folks have been asking, like, how can we help? What can we do? Can we drive people? Can we do this? Can we do that? I think people have to be reminded that folks are going through this time in their life in which they have to leave the state, and also like under scrutiny from their state. So there is fear with some folks, and we can't always just entrust the folks that call us with strangers, you know, for better lack of a better word, to travel with them somewhere. So we really have abortion funds in the state that provide logistical support, and funds like ours that provide financial support, that have been doing that work for years and are the experts. And we really just like need fiscal support to help keep doing the things that we've been doing well. And all that to say, like, it's not an easy thing that's happening here. And so I think we just would really ask people to trust us and invest in the leadership of the folks in Texas. But also you can support the WIPA Act, Women's Health Protection Act, which would on a national level reduce a lot of abortion restrictions and overturn these things, so that it make it much harder for states to pass restrictions at this like level. Yeah, and just like look to us as leaders and guides, see how we're talking about abortion, talk to people about abortion, like reducing the stigma, I think is one of the hugest things.
That's real. I am just like thinking about, in your speech, you said like many clinics are not being able to reopen. And it just gets me thinking about the sustainability of this, like going back and forth with the courts, going back and forth with legislators. Like, what do you think that will be needed to restore abortion access? Like, what needs to change in Texas or in other states or in the country in general? Because I know, like, at one point there were 42 places where you could get abortions in Texas. I would say like back in maybe 2013, and how many are there now today, and how many are going to be able to open if, you know, Roe v. Wade is to stand, or if, you know, the bill is able to get like overturned for some reason. Like, how many can come back? Because that
exactly. I think it would be hard for a lot of clinics to reopen. It took one clinic that we work with in Dallas 3 or 4 years to reopen after HB2 that happened with the Wendy Davis filibuster and all that. Like, it took years, right? And I think that if this happens like nationwide, where clinics close all over the country, it's going to be really hard for them to reopen, even after some sort of a legal battle, right? Mm-hmm. So I really think that in Texas, like, we were never able to meet the need of people accessing abortion before SB 8. Mm-hmm. We had more callers than we could fund. There were more people that needed to travel outside of the state that couldn't then. And now it's like even worse. And so I think what we need to have things restored is, it's not even just about what's happening in June. It's not just about SB 8. Abortion was already too hard to access before any of this. We need abortion on demand free on demand. I need to be able to go wherever I need to go and be able to get there easily and have this procedure covered. Like, I think we need, I don't know, maybe Medicare for all and abortion's part of it. Or we need like universal health care and abortions covered. I mean, I think we need like a whole, that's what we need. But then that's
not a restoration, but something totally new.
Yes, we need new. We can't keep
This cannot be restored.
putting tools into the system that's messed up. Like, we need an overhaul, buy a new one. Like, that's what we need.
Get a new car, get a new house,
Yeah.
do everything. Yeah. Well, that sounds beautiful. I'm waiting for the day, not just waiting with my hands, you know, under my knees or anything like that, but just like waiting and doing the work at the same time. And we see you, we see the work that you're doing, and we send big love to Texas. And we thank you so much for your time. We thank you so much for sharing your light with us, especially in these times. We know it's hard out here, and
Yeah.
It's beautiful to see, like, even though it's like really difficult times, though it's challenging, that you're still taking care of yourself and like putting that as like a centerpiece of the work that you're doing. And I, you know, echo what you say, that we need to encourage people to do that. And so thank you for bringing that message along too.
Definitely. We got to have ourselves and each other to get through this. So,
yeah. Well, thank you, everybody.
Thank y'all.
Listening to Kamyon with me for this Unrestrict Lobby Day.
Hey, y'all have fun on Lobby Day. It's a good time.
It's a great time. Like, hey, we're doing what we can do.
Yeah.